So now, right after we have had this very interesting discussion, we have probably lost a little bit of productivity in our healthcare system with this very last period. So thank you very much for Guy for having given us the floor and for letting us talk about efficiency. This is the topic that we all understand in consensus that this is an ideal for all of us. Yes, indeed, we did a lot of progress in this sense, and I believe that we will be tackling some examples and mentioning some examples of this progress. And we are still deploying all of our efforts, and I believe that we still have a lot to do here, so we will be talking about it. So the consensus is quite good here. We will be talking about the content, we will be talking about the nominators and denominators of efficiency, and finally, the ideal for us is to have the improvement of the health of the population, the health state of the population. And it's important for us to make sure that everyone can benefit of this performance. But do we have the right indicators? Do we have the right data? Do we have the right individual indicators? Who knows them? Who uses them? And also whether the patient is aware of this, because the topic of this Congress is indeed the patient. So the practices are evolving slowly. So are they evolving as fast as the challenges are evolving? Financement, are they stimulating enough, and are we valuing enough the innovation? So all of these questions, we are trying to tackle them first of all throughout the state of things, and then we will be talking about it in more detail. So first of all, I would like to give the floor to Nicolas BOUZOU, who was very much inspired starting from this morning. So what is pretty much the challenge for the length of life? Well, we are saying that it actually increased of 20%. Yeah, this is quite good because, well, I have been not in agreement with this idea that in the field of the efficiency, we were saying that we did a lot of progress here. Yes, we did a lot of progress talking in words, but I agree with you. It's very important, and we probably will go back to the topic talking about the indicators that are probably not always good. So we actually don't have a consensus around the indicators, but we didn't have any progress in terms of efficiency, because we're not daring enough to look at the organization of the healthcare system. Just to take an example, well, this is a very concrete example in order to launch the debate, because this is a topic that is very, very, very hot right now, very timely right now, and this is also something that tackles the financement, and this is the question of hospitals. Well, hospitals, we're investing into the hospitals. Probably we weren't investing enough. Right now we are investing more. We are putting over 90 billion euros every single year, so this is quite an amount, and we don't have any gain in terms of efficiency. So some people can basically notice that. Well, I'm a little bit sorry because I started talking about my personal life this morning, and I have to continue this afternoon with that. Well, just a couple of minutes. It's important for the sake of the example. I also have some experience in the hospitals for some people of my family, and I actually saw that the hospital organization is doing the dis-efficiency. So everything is organized so that not to have any gain in efficiency. So everything is organized, and I will be able to explain it to you if you're interested. So everything is created so that all the process will be disintense in demotivating us to be more efficient. So if we do not look at these questions related to the organizations of our delays in digitalizations and so on, we have a lot of topics here. So until we start looking at all of this, we will keep investing in the system. But because the system is very badly organized, the yields will be decreasing and frustration will be increasing, which is why I believe that we have to pay attention to this. I'm sorry that from the very beginning I'm basically starting on the negative note, but I have an advantage with respect to my colleagues because I'm not within the system and I can say everything. Well, what I wanted to say is that in the hospital, and Marie-Noëlle GERAIN-BREUZARD is with us remotely. Yes, of course, I'm here. So I believe that here, what Nicolas BOUZOU has said, whether we can talk about the efficiency in the hospitals, whether we can do some progress here, what is your vision from what has been done up to now and what we still have to do? Well, hello, everyone. Even though I am within the system, it does not actually prevent us from having a critical view of all of this. Well, I'm not really sure that I will be having exactly the same clearly stated position as Nicolas BOUZOU. I believe that this notion of efficiency appeared little by little with the modification of the activities and the system that actually showed us that everything was financed, that whatever we were producing was pretty much financed in the same way. And right now, because this notion of efficiency completely passed by the notion of relevance of our organization, efficiency equals economy. And economy meaning saving. And saving on what? Well, something that the director can master, but this is not something very glorious because this will be the labor force of the non-medical staff. And for the director is really very difficult to carry out this notion of relevance on his own or her own, which is why this notion of efficiency is basically going down to something that everyone refuses, meaning the constraint, the rationing, but passing right next to what should be important for us. And for this reason, I believe we can massively talk about this. Franck van Lennep, what is the ambition in terms of the efficiency for the 5 upcoming years? First of all, I am not really sure that I share the point of view that is just as dramatic. Well, yes, definitely the progress is not as fast as we would wish, but nevertheless we still have progress. And without starting the debate about efficiency, because efficiency is first of all the quality for the patient, but also the cost effectiveness. And once we said that, we can basically see that we are talking about the constraints. And we always have this constraint no matter what decision we will make. So there will not be any obvious answer. And this is something that is multi-factor. That's the first point. And the second point is that we're talking about actions in terms of efficiency. We're talking about hospitals, but we can talk about the city or about some medical products and so on. Well, these are multiple actions that will tackle the internal efforts in terms of health, but also the efforts of people working among them, but also the efforts of access to a doctor or to a treatment. So if we are doing this rationing, well, of course, the system will not be efficient. It can also tackle the prevention. So this is the whole system that must be efficient. And every single part of the system, for it, we have a list of actions that we can come up with. Well, for some, of course, we can go further than for others with this list of actions and so on. Well, this is a vision that is otherwise very much theoretical in terms of efficiency. And in order to transform it into action, of course, we need a frame, theoretic frame, but also a strategic vision and a plan of action, an action plan such as we have had last year. And of course, we can say that we're not advancing as fast as we would wish. But if we look at the hospital 15 years ago with operations and surgery, we can see that the progress was quite significant. We can also take some other examples, and very fortunately, our health system is progressing there. So this is what the government has also announced together with the presentation of PD. So this is that for 2023 we will build up the strategy related to the efficiency, because one of the levers of the efficiencies, well, just one of them, is the relevance. So we will have to rebuild our pluriannual strategy with all of the actors, so that it will be a guiding principle for the upcoming years for us. So, and you are talking about building the strategy. Yeah, well, we will build it in the upcoming months at the beginning of 2023. Florence LUSTMAN, you are representing the insurances. The insurances are very often defining themselves as blind payers. When you are a blind payer, can you contribute to the efficiency of the system? Do you believe that this is the case? Well, we have this particular problem of working with our insured people, our clients, and we have approximately 96% of French who have complementary insurance. And what is interesting is that they want it, because we have the system that is very much divided. And what is very interesting here is to go and look for the efficiency in every single division in order to achieve this global efficiency. So the discourse that I would like to present here is that everyone must be around this table in order to serve this common goal. And this common goal has been mentioned by Nicolas, and we can basically find it in this white book that has been created for the health during the presidential campaign. We have found out 4 important challenges in the field of health. First of all, the access to the treatment, the fragmentation of all the journeys, which are very difficult, and this is what we see for all the people who are our clients in insurance. So it's very difficult for them, but also this is the prevention, which is historically a big missing element, the life expectancy, which is of 63 for males and 64 for females, even though in Europe it's a little bit better. So basically we have some progress to make here, but also we have this situation that is affecting the future generations and is basically reflected on the future generations. But in order to federate all of this, we don't have to forget all the caregivers, all the actors, all the supplementary insurances and so on, but also citizens. Citizens must be at the very core of this game. And I believe that this project is a societal project that we have to carry out altogether. Then each and everyone must define what they will be able to do. And of course, we will be able to see what are the special leverages that we can use as the insurance systems. But our health is our capital for all of us. And the citizen, and unfortunately the citizen, whenever he or she is sick and they become a patient, they must be at the very center of attention. That's for them in order to capitalize on the capital health that they have. And for that reason, we have to all gather around this table and think about this efficiency for our co-citizens. Florence DUPRÉ, in the system of health, well, of course, you are from the industrial sector, and this is the sector that you are representing here. So you are the very first, the only one that are evaluated on the criteria of efficiency, and how do you take it? Is it okay for you? And finally, does it allow you to progress better, or do you see it as a huge constraint? Well, I can say that it's at the same time good and bad for us. Good because we are looking for this relationship between the resource that we are using and the result that we are getting. So it's basically it makes a lot of sense. No one can say no to that. Either we are a citizen or an industrial. This is an important research. But just the way to get there, to find this return on investment, this is the DNA of our company. So just to answer your question, for the positive side, yeah, we take it very well because this is our way of working. But we also, it is also bad because the way of us, the way of our evolution means that we could have progress in terms of efficiency. And when we're looking at the previous presentation, the technology is related to health. The health technologies are the major element of efficiency and of transformation of the healthcare. This is something that our colleague from Abbott just said. But whenever we are looking at what we are using, well, this technology are telling us, use us more, use us even more, because sometimes we're very well evaluated. And it actually, we are talking about the whole journey of treatment. If we're talking about a short period, now when we are coming with medical and economic data, we are very much understood. So if I'm looking at the cardio patient and so on, for 10 years, we have this data and we have certain elements for evaluation. But whenever we are talking about the journey for the treatment, that's what you were describing, very fragmented journey, small pieces. Now that becomes really difficult. So when we're talking about bariatric surgery, the surgical act is very performant if it is surrounded by something. So we have been talking about the Article 51 and so on. We have been working on something, but it's still experimental. So the big question is, when will it come to the general public? When everyone will be able to enjoy it and to benefit from it? So what are the fields on which we don't have this understanding, let's say the pain, because we still did not find a way to finance innovation for that? This is very interesting, and I would like to talk indeed about the efficiency of the organizations, because you were saying that we don't have an efficient health product without having an efficient organization. Yeah, because this is a system. All right, so you have mentioned the Article 51. So for the Article 51, this is an incredible tool. A lot of people appreciate this article as a tool, and this is also a an element that is very lengthy to put in place. And also when we're talking about telesurveillance, this is something that is evolving right now. And if we look at the law of 2009, talking about this video surveillance and so on, in 2023, we will start working on this decree. So 15 years, in 15 years, we will not be able to use up all the goodwill. So why does it take that long? Can't we do better? Because the price to pay for this delay is absolutely huge for the healthcare system. This is why I'm looking at you, because you are finally very much in rhythm of all of this. Well, I haven't taken all of the decisions starting from 2009, right? You would have done differently. I don't really know. But what is really sure is that the administration will not really tell you, yeah, we have this innovation and we don't want for a patient to access it. Of course, when we have an innovation and this innovation has some evidence and we have some elements that are already positive, even if we still need additional proofs, but we understand that the innovation is very useful, we will tell everyone that patients should be able to access it. Well, of course, we understand that in terms of drugs, we're trying to develop it little by little, but the process is much lengthier and much more difficult. Nevertheless, things are ongoing right now in order to make sure that this access is fast and for the patients so that they can access this innovation even faster, even though we don't still have all the prices and all the evaluations and all the data. This is the first thing. Now, your question about the Article 51. You said that it's lengthy and complex. Well, of course, the Article 51, this is the framework. And first of all, we are talking about the experimentation. The experimentation is always quite lengthy and quite complex. So whenever we are talking about experimentation, first of all, you have to define the project. Then you have to recruit patients. So you need some time because you still need to treat these patients. Then you have to treat the data and to evaluate. But this is exactly the same thing as some years ago. It's the true experimentations. It's everywhere exactly the same thing in every country. Now the question that comes after is what is the speed that we can have starting from the proofs that this experimentation brings us to scale it up. So if we take the example of the telesurveillance, the rules that we have and the articles that have been voted last year for 2022, which are generalized in the telesurveillance, we haven't seen the common law for the taken in charge telesurveillance anywhere else in Europe. So in Europe, with respect to what we have seen, it's still quite experimental. So we, of course, we have done some experimentation, and starting from 2009, we have already done some of it, and some of it is still ongoing. Yes, indeed, with respect to this, I wanted to know whether we cannot accelerate. Well, we are already avancing faster than most of them. You were saying about this, you were talking about this decree for 2023, but it's actually for 2022 that things are happening already. And telesurveillance, this is something that has to be put in place. So the costs are here. How much should we pay the industrials and the professionals and so on and so on? And whenever we're talking about costs, well, of course, it's quite normal. We are, of course, trying to negotiate because this is a public money and we're trying to find the best price and so on. So all of this will be effective at the end of 2022. And I believe that this is even earlier with respect to what has been announced for France. Yes, exactly. Especially because we have seen this piece of news with a lot of interest 1 year ago. But I believe that the challenge will be with respect to the evaluation, which is why I would like to say when we will be passing to the common law, will this kill the telesurveillance or develop it? It depends on the way that you're going to finance it, because if it will have a cost that will not allow all the actors to develop themselves and to take advantage of all of these benefits, it can actually go very quickly. And very often we have looked at it throughout the costs and not from the point of view of the investment. So the fact that we will be able to have this evolution, we can kill it or we can have a very good impact here. Well, the work that we're doing here is not to kill it. Well, yeah, this is for that reason that we're working all together, so that not to kill it. So the efficiency of the organization, we have a lot of things to do here. Well, I wanted to go back to what has been said before, just saying from the point of view of the organization. I believe that we have a lot of things to do here, and we have had this afternoon a very interesting discussion about the precaution, and we are coming back to this because we're talking about the healthcare system and the efficiency and so on, because this precaution goes against it sometimes. And I have been talking about it. I have been talking about the GDPR, but also the governance of the hospital system. And I would like to stay a little bit longer on the hospital, something that I have found extremely interesting. And this is the sentence that I found absolutely fascinating, because sometimes it can go to absurdity. For instance, I was said, Mr. Bouzou, I didn't know that you were German. I said, I'm not German. But they say, well, it's written here. I was like, wow, well, this is an argument against which is kind of difficult. Well, I didn't really doubt it myself, I cannot say that. But it's really hard to fight against it. So as long as we are not looking at it, well, right now I'm joking, but I can tell you that, like, really, if we're not doing the loss of profits, we will not have any efficiency. Now, going a little bit beyond the scope of the hospital, I would like to stay around this question of technology. The technology is underused in reality in a lot of parts of our system, healthcare system, I would like to say. Just look at the general medicine, general healthcare. If you go to see your general practitioner, in reality, they use very little technology. They would use, let's say, some tools to measure your tension or things like that, but this will be traditional tools that are here for ages and ages. Now, let's say I took to the hospital not only my son, but my cat, and it was approximately at the same time. But the efficiency of animal health is absolutely surprising. It's much more efficient when you take your animal to the doctor. Well, you can see that the efficiency is absolutely incredible. And a lot of people are laughing because they say, yeah, he's absolutely right, because you can see all these things in our lives. Now, what I can say here, it's actually very quickly, because they will do all the imagery, all the scannings, they will take their blood, and so on. And within 1 hour, we already have all the necessary information. So the journey in itself, we have to think about it. For our pets, it's much more efficient than for humans. So I think that we have to look at it. Well, we're not talking about euthanasia. Well, I'm just saying it like from the point of view of humor, because I can accept that we are joking around about this. But probably I'm reinforcing a little bit this information, but not as much. And just going back to the question of costs, because it has been mentioned, yes, indeed, we have to have this vision, especially in terms of all the devices, medical devices, because we have to look at the long run, and we have to think about the investment, social yield, and all the questions of the social reality that are intervening and so on. And very often we are reproaching the governments, talking about it publicly, but when we are looking at the Luxus and PLFSS 2023, we basically have this contractual contradiction. So you cannot say that on one hand we will be building up once again all this subsidiary that had here, but we will have to stop the contract. So when will we include the industrials in PLFSS? Because these are the contradictory questions that are not accelerating this efficiency. Well, I don't believe that Mr. Bouzou is the representative of the industrials here, so I believe that we will be discussing this with the industrials. And I will explain to you that each and everyone has his or her arguments, and I have heard the arguments from the industrials as well. And indeed, in parallel, I really believe, just to interrupt you very briefly, I am reflecting with my, I'm thinking with my head and not with my money. Yeah, I will explain it to you, no problem. And also, we will not be comparing the care of humans and the care for animals, because we can see what right now the surgery and everything for humans represent, because this is much more advanced. Well, I was talking about the general practitioners and not about the specialized surgery and so on. Now, for the efficiency of the organizations, Marie-Noëlle, GERAIN-BREUZARD, the role of the hospitals is very often pointed out as being over-dimensioned, and the necessity of articulate city hospital and so on. Well, these are the evolutions that are very lengthy and very difficult. I think that this is also part of your wishes, and you are working on it every single day. Can you please talk to us a little bit more about this? Yes, of course. I was talking to you just before. I was telling you just before that the meta goal for us is to improve the health of all the population. So this is the meta goal, and I believe that it has to federate all of the actors. So once we said that, we have to think about how. But it's still important to say it, because obviously the goals and the indicators that go with it are part of this reasoning. And I am supporting the territorial reflection, territorial thinking about the financement of the healthcare, which is at the crisscross of many different systems. I believe that this is quite complicated, and we have been talking about the Article 51, which is quite complicated to modify the organization and the financement of the healthcare system. Yes, it's complicated. Nevertheless, we are at the beginning of something that will be major for us. We have been talking about the disaster that we have had previously and so on, and with this breakdown of all the financement that we have right now and the problems that we might have in the future, I believe that this is a collective challenge that we have around this notion of relevance and of the global financement of the hospitals by the city and all of the actors. And I believe that around the organization, well, obviously, hospital is part of all the chain of the care with the veterinary and so on. And let's say the hospital that I'm working with is also the chain of organization and a chain of decision that is quite lengthy. And it's definitely not a veterinary, and it's definitely different from the veterinary. But also, I wanted to underline the need, because I have heard this afternoon many times saying, and these were doctors saying things to doctors, about the ability to question their own practices and to, well, it actually also is part of all the organization in a hospital, because the doctor is the main actor of decision in a hospital, and the nurses and everyone else are basically turning around the medical organization that is in place, which is why we seriously need, and once again, I believe that everything that we have heard this afternoon was really very encouraging, because we're talking about a very important level of awareness. But then we also have to start acting and transmitting it all to the field and see what are the interactions. Yeah, well, with this awareness, the doctors, are they contributing enough to the creation of data which would be relevant and of good quality? And one of the questions, finally, is the availability of the indicators that would allow them, first, to be evaluated, second, to self-evaluate, and third, to progress in this field, because we believe that everything is done somehow blindly, gropingly, so at least for doctors. So this question, we are also thinking about this warehouse for the hospitals. So what will be the place of the data that will allow us to steer all of this in order to move towards quality? Well, what is sure is that indicators of performance that we have right now are a product of the information system, and they basically go back to the information that is being entered. And this information has to be of good quality, but this is not always the case. We are talking about all the regional or national tools, and we are trying to collect the data in a more intelligent way. Nevertheless, we need this data management at the level of the hospitals, and right now it's still very much based on the indicators that are quite not adopted, that are talking about the length of the time that the person spends there and so on. And we are talking about insider factors for the hospital, but we have to think about evaluating all of this in a systemic way for overall territory and between all the actors at the city level and all the actors from the healthcare sector and so on. So it will be like the third dimension, meaning that we really don't have an information system and we don't have this interaction between ones and others. And for the whole of the territory, the information systems are we can do very little with them right now. Well, probably having more measuring elements will allow also to re-evaluate professionals, because finally the professionals, medical and non-medical, they have no idea of the sense in which finally they are working? Does it add to the tension in which you're living and that you're commenting on a lot in the hospitals? I believe that the professionals are pretty much aware of what they are producing. This is the translation of all the indicators and all the data is not sufficiently good and sufficiently underlined, but the fact of being able to show the collective production, well, to say that anyway it works and all of this is very good. Well, it actually does work, but throughout the data that has been entered, but we can hear our doctors say and speak about the state of things and so on, and the coding and things like that. But we have to enter this data, and we have to do it in a qualitative way. And starting from here, we can produce something intelligent in terms of relevance and in terms of efficiency. So, on one hand, we need to establish tools. The tools, once again, the documents on health and all the progress has allowed us to advance in terms of healthcare systems as well. But also, we have to enter this data into the systems. Yeah, well, finally, all of this brings us to a fundamental question, which is, do we have the culture of quality that is sufficient? Do we have this desire? Does our society finally, will our society finally tolerate all of this? Because without this culture, we are basically paying is quite, well, it costs us quite a lot. And finally, for the patients, is even worse, because we don't leave them any other choice than to go to Google and to try and find any idea of quality. Well, what you're saying here is very fair, because very few patients, and that's what I see in terms of their reactions. Well, CHAM this year decided to work on the patient, and a lot of said, well, this is interesting, this is new, and so on, this is quite special. Well, we can see that this is something that is not in our habits, which is not normal. But on the other hand, the healthcare sector is very heavily regulated, that's normal. So we're trying to somehow reconcile equity and efficiency. So necessarily this is extremely complex. So it kind of makes sense that we are doing it in this way. But I believe that it also makes sense to put the patient in the very core of all of this and to put it as the main goal. Because the indicators in terms of the healthcare systems, we have loads of them. I have been working in a lot of different sectors, and we can see that for the healthcare we have a lot of control, and most of indicators probably I can say, most of questions I can say, and so on. But what I believe is that the true topic is what you would like to suggest, is to be able to really build up indicators that well reflect quality. This is something that is very difficult, and I believe that it's impossible to do it in a centralized way, because that's too complex, to just decide that, yeah, we will create this indicator and everyone will have to follow the system. Because unfortunately, we still have to have this very first phase that will be the phase of disorder. Yeah, disorder. I totally understand what you would like to say. You are living in this paradox, which is the data of real life. And finally, you need this data in order to go to the market, but you also need to be in the market to have this data. Yes, indeed. And also, I would like to say that one of our challenges is to be used in order to be evaluated. And I'm coming from the world of the drug, because I have been working there for 25 years. And a big discovery that I found when I came to the world of health technologies is how much we have the impact on the organizations of care and how we have to invest. And it actually takes a lot of time to train surgeons to create these organizations of care, because whenever we're talking about the healthcare technology, we have many people. So it's not just I prescribe something and the product is delivered and then we can see whether it is being taken or not. No, we're at the very core of the hospital activity. We are right next to you in the hospitals. And I understand what you're talking about, because with respect to the outpatient care, a lot of progress has been done. So you have to allow us us to be used. You have been talking about this and indicators with this pluriannual notion. If we can be evaluated in time, and to say that altogether we're looking at what the indicators are, the indicators that will allow us to say that more use for the health technologies will be equal to the gain in efficiency. If we will be having this dialogue, I believe that we will have a win-win situation. Can you add something? Yes, indeed. I wanted to say that 5 years ago I have written this report in the use of data in real life, about the use of data in real life, and I was talking about our system of drugs, or organization, and tools that are used in healthcare should allow a very early access to the patients, because first of all the patients are here, and then to have the follow-up, well, while respecting the safety for the patients, of course, and also development of the data in real life in order to evolve the impact on the lives of the patients, but also for the prices. So I have been thinking about it for quite a while, and it was important to take into account the true efficiency in the life cycle of the product. But to go back to the general question about quality, there are two important components. First of all, there is the access of the patient and of the citizen, of everyone, to the data, to the information around quality, so the transparency of the information. So, of course, we are talking about hospitals, but this is not the question that concerns just hospitals. Well, Google too. Well, yeah, on Google we also have doctors and so on, but it's not just here. It's actually still insufficient, quite insufficient, with respect to the availability of the data and what we can do with all of this. So we can continue to develop information that is basically a must for the patients and for the citizens about the quality of the healthcare system, about the quality of the treatments. And of course, for that, we need to have some indicators. And these indicators must be quite robust, but also readable and understandable. Today, we have some indicators at the public side. Of course, they could have been simplified, but they are not sufficient today. So the first thing is the access to information, so that everyone will be able to get informed. But on the other hand, we're talking about costs, about prices. And right now, we are in the period of change, probably not very fast, but still the period of change, especially in the hospitals, because we have all these reforms related to the prices and so on, about the emergency service, psychiatric services, and so on and so on. So we are reforming right now the prices, which also integrate the quality, and also we have the financial incentives for the hospital that right now will go from 200 to 500 millions in 3 years, and I believe that it will continue increasing in the future. So we're talking about the indicators of activity. No, this is not just activity. We have too many indicators of means and of process, but the goal for us is to develop them even more, because these are the indicators related to the result. But as we have been saying, they have to be taken from the files of patients and the system of information, because it's really difficult to ask the professionals to enter this information into the database twice, because it's already quite difficult to enter it once. So we still have a lot of progress in order to talk about this data that is in the system related to the patients. And we have the advantage of interconnection and so on, and we are still in the very middle of this process. But just to tell you that we have 2.5 billion of data that has been digitalized in terms of healthcare. So this is the data for the city. Aren't we here a little bit imprisoned by the medical convention, with a system that has a lot of things that has been negotiated upstream, and then downstream we don't have any control or any sanctions? Well, this is a schematic approach, but pretty much this is the logic that we're using here. So if we're looking at this process, we understand that politically it actually allows us to protect the relationship with all the health professionals that are very important. But finally, we have the risk, because we're not moving forward, and the risk can have extra costs for us and some chances that we will be lost. But we have also commented on the role of the healthcare system here in France. And don't you think that this will prevent us from the progress in this field? Well, I can tell you that I'm dreaming about it, that progressively all the things that we are doing within the experimentative framework, especially this Article 51, when we're talking about the manifestation of interest, and these are the things that we're considering at the national level, and it actually allows us to look at the basis of the very territorial organization. And it's important for us to start start implementing all of those new tools that are basically being offered with the new prices related to quality, prices related to teams as well, and also incentives that can appear as bonuses or as substitutes, meaning that teams could also select a certain experimentation and select a different type of package. And for the professionals, they can basically organize their time completely differently. So this will be an additional flexibility, because very often people were saying that the allocation of time was done very badly. And this is the experimentation that we're doing here in France. So for me, my dream is that this Article 51, especially you were talking about how we can go to the generalization. So for me, it's important so that it will be part of the negotiation of the convention, and it also would appear in this medical convention so that all the insurances as well as the doctors will be working together and build it up all together. Well, I'm not very pessimistic, just as pessimistic as you, because you're saying that through the convention we cannot really obtain big things. But I believe that the progress is definitely possible here, together with the measures that will be done a posteriori and control and sanctions and so on. Well, control and sanctions are different things, because if you start sanctioning, well, today the sanctions are definitely possible. When we're talking about fraud, of course, well, fraud, yes, of course, when there is a doctor in the health sector who commits fraud, but this is not the point here, because the topic is not just this, it's not exactly the sanction, is to have a good system with enough incentive, and the price systems are progressing right now. We have created new packages, new possibilities of pay and so on, but whenever we are comparing ourselves to other nationalities, we can see that we still have a lot of improvements, but we still have some data that also shows us that it works. So now talking about the prevention, because we have mentioned this point already, of course, about this, prevention plays a very important role, but Florence, in this field, which is not very much regulated, we still have some space here, and we have seen this morning the enthusiasm of David Giblas in this field. I believe that we can do a lot of things. Probably insurances can do even more. What is stopping you, and how probably will you use this topic in the consensus, because everyone believes that we should do even more, much more? Well, first of all, I would like to tell you that my job is to manage risks. So, of course, we have the comparative with all the other risks that we are managing. Either it will be insurance for car or for houses or against natural disasters. We can see the efficiencies of some companies like CHAM. CHAM is the campaign that says that whoever drives does not drink. This can appear as something basic, but you cannot even imagine the impact that this campaign has had. So I'm coming back to this, but I believe that probably CHAM 2023 will be the citizen of tomorrow, and the citizen of tomorrow will be someone with who will be working on their prevention. Well, of course, we are thinking about a lot of things, because this is part of our DNA. The best worst scenario that we have been able to avoid, because we are investing a lot into the health, but we have regulations. We cannot do a lot of things. We don't have the access to the data, and the real challenge is that if tomorrow you can give us the access to the data, of course, with the agreement of the person who will be insured with their consent, but we will be able to adopt this prevention to the special case of the person who is in front of us. But even in this very small space that we have here, we have developed a lot of different preventive programs. And in majority, this is true in the companies, meaning that the complementary insurance in the companies, this is the field where prevention is very efficient, because messages can be repeated, because all of this is taken on the time of work, the paid time of work, and people are much more receptive. But even in terms of individual insurance, we were able to see, especially during the COVID period, the multiple access and the increase of access to many platforms related to coaching, related to professional diseases, addictions, and so on, finding all the difficulties in terms of mental health and so on. And this is something that complementary insurance was taken care of. So we were saying that we would probably reimburse you a certain part of psychology, consultations and so on. So we basically are in the field. So we have this ability of reacting. We have contracts that are very much customized and personalized. And let's say the employees of construction sector would not have as much, would not have the same complementary insurance as workers in the bank. So we have several categories of homogeneous individuals, and we can suggest some tools that will be efficient for their group. But we can go even farther with that, just to finish on this idea. This is something that is directly linked to the innovation. So thanks to the savings that you are giving us and to this prime free insurance that you are paying, we are one of the biggest investors. We have 2,700 billions of investments, and this is the wealth that you are trusting us. And obviously all of this is invested especially into the healthcare, into the innovation in the healthcare. And just in 2020, we have invested 800 million into the innovations in the healthcare because we were very much worried about our sovereignty and health. We have invested into the health-related companies and into the innovative devices. Just to give you one example, this was the program of France Biotech, and this was a program to favor digital solutions in terms of the journey for mental health. So whenever we have this, of course, there are some insurances who invested in the systems called Visible 3D. This is something that allows us to reconstruct different organs, and I believe that it's especially very efficient for the surgeons that will be doing surgeries on some organs. But you can see these complementary insurances that are also investors that saw these possibilities, these opportunities, and invested into these innovations. And it was very interesting to invest into it because it actually generated some profits as well. And we are not the only ones doing this because we are giving this medical technologies to a lot of people. And just to finish, I would like to say that the teleconsulting was also introduced by the complementary insurances. Right now is getting democratized a lot, but thanks to the complementary insurances, innovation is coming probably not directly to the patient. Nevertheless, it becomes available to most, meaning 96% of French. So for the prevention, what you wanted to say, yeah, for all the preventive actions, what I wanted to say, this is good for the public health, but not all of them are very efficient in terms of cost, because some of them are very, very expensive. We also know, because all of this is very, very documented, we know some of them, let's say they finding out the cancer of the colon between 56 and 60-year-old. This is something that can be efficient in terms of cost. So for all the vaccines, this is very, very efficient in terms of costs. Let's say against the papilloma virus, this is very efficient. And in the UK, they actually understood how good is this because they saw the consequences in terms of public health and so on in order to avoid the cancer and diseases like that. We are not as good as them yet, but I believe that this is a great topic for the social partners that sometimes are looking for kind of regional and special topics. I see a lot of companies that would say, we will give you 30 minutes free each day so that you would be able to do some physical activity. I believe that this is an important leverage that we can use, and especially it's very interesting and creative right now that when companies are trying to attract employees, I believe that this is a regional approach that we can explore. Yeah, I believe that we have to think about it when we go back to our office. Well, this is not the same thing. Yeah, you wanted to add something, right? Well, we have some very physical things in some jobs. Well, this is another debate, but I believe that for PLFSS, this is the very first time that we're talking about this necessity to evaluate on the basis of the carbon footprint and on the basis of the sustainable development sustainable character, of health products. So you, as an industrial, probably this is part of the elements on which you are working already. How do you perceive it? And how is this linked to the prevention? Is it a different approach? Are these elements important in the long run? How did you integrate all of this? Well, at CHAM, our responsibility, societal and environmental responsibility is very, very strong, and it is completely integrated into our company strategy. So whenever we're working on our human capital, you have been talking about the physical exercise, that's what we're doing, but also the question of how can we develop develop our teams, because there is still this part of social responsibility, and you have the employees that are part of it. And obviously, we also have this very important challenge, which is the challenge of recycling. We have been talking about it for the health technologies, and all of our partners in the hospitals, when they do their tenders and so on, this is clearly stated today. So if we do not if we do not have a certain criteria, we can no longer play, we can no longer participate. So this is an important element for us, and we didn't take it as a constraint. We actually took it as an efficiency lever. Yeah, so we are working on all of these elements. Yeah, I understand. So we are basically coming back to this definition of efficiency. So as a conclusion, I would like to suggest an exercise for the four of you. So we are at CHAM 2032, and I would like for you to give an element to present at this very round table that we are organizing in 2032. So to say what has been determining in the 10 previous years between 2022 and 2023, and Guy Valencien selected as the topic the efficiency in health in France. So what I would like to share is to share your dream. Your dream meaning that all of these experimentations finally become the part of the current evaluation of the health technologies, because we have this very important impact on the healthcare journey, and we have to evaluate it a little bit like the evaluation of pain, as we were talking about the cardiology and so on. So our health technologies will not be evaluated on what they can bring to just a certain small part of the system, but to the system in its whole. And it actually also represents the need to structure differently our collaboration, because right now we have like 10 to 20 different actors, so probably the Agency of Health will bring forth some visibility in this term. Well, for me, around this table we will have a citizen that will be in the very center, and they will tell us what they understand, what they don't understand, what they like, what they don't like, what works and what doesn't work in the system of follow-up, I would say, not the healthcare system, because for me it's important to have the citizen in the center. For 2032, what will I be able to say? We have a health system that is oriented on the patient and not on itself. For me, the citizen patient is in the middle of our discussion, because we all are patients. So obviously we start all with our own experiences, and this is also part of the important things that are creating our conversation. And also, just as Nicolas BOUZOU has already said, so that the health will be organized for the patient. Thank you very much.